to Module 3. My name is Maria do Rosário Martins and I am Professor of Statistics and Research Methods at the Institute of Hygiene and Tropical Medicine in Lisbon, Portugal, and I am also the coordinator of this module. Today my topic is on the definition and specification of implementation strategy. This is the first talk in the series that will discuss in detail the design of an implementation strategy. Let me begin by giving you an overview of what I want to cover today. I am going first to introduce you a real-life example related to bed nets delivery in Mozambique. Then I am going to talk about two possible definitions for implementation strategy together with real-life examples. And finally, I'm going to present 5 important dimensions that are very useful in the description of the implementation strategy. So, the fundamental point that drives this segment is that implementation strategy's description must be very precise. This explanation must allow us to measure the different components of the strategy and also to reproduce it. At the end of this chapter, we hope that you will be able to identify the different type of implementation strategies, to specify the different type of implementation strategies, and to use these concepts in real-life examples related to diseases of poverty. Let us begin our lecture by presenting an example related to the bed net delivery in Mozambique. So, what is the problem? Malaria is considered the most important public health problem in Mozambique. It is the leading cause of mortality, with 35% of children aged under 5 years testing positive for malaria parasites in 2011. Moreover, in these children, malaria accounts for 42% of deaths. In addition, we also know that malaria prevalence is different across the regions, with very small figures in the capital, Maputo, that is around 1.5%, and it is very high in Zambezia, with numbers around 55%. And we can all see that in general prevalence rates are higher in the north and lower in the south. And in terms of coverage, the indicators are also below the target. As we can see in this table, in 2011 only 36% of children under 5 slept under a bed net. Furthermore, only 34% of the pregnant women slept under the bed nets. One can ask why the different intervention does not reach the desired outcomes. We have a health problem. On the other side, we know that there are efficacious interventions. So what do we know exactly? We know that the use of bed nets, in particular long-lasting nets, are efficacious. We also know that the use of bed nets reduce malaria episodes among children. And finally, we also know that the use of treated bed nets are cost-effective, namely the long-lasting ones. However, there is still a low coverage in Mozambique. So, again, there is an efficacious intervention, but there is an implementation problem. We need to develop or to design strategies in order to improve the bed nets used by the population in need. As conclusion, we know that the use of bed nets reduce malaria transmission rates, but we need more research into the most effective and sustainable way to deliver those bed nets and to assure that they are properly used. But one can ask, what are the reasons for this failure? The literature identifies several reasons for this failure. On one hand, there are several issues related to supply chains in the country that don't have a formal system for routine distribution. On the other hand, in Mozambique, there are poor road conditions. As we can see in the map, Mozambique is a very large country and many districts are not accessible during the rainy season. Finally, there are also issues related to the poor information management systems to detect shortage and stockouts of malaria products. So, we have a research question and we need to develop effective solutions for the problems related to implementation. As we already know that in the first phase, we need to identify the problem and its context. And then the second phase is related to the design of implementation strategies. But what is an implementation strategy? Well, it is not easy to find in the literature a consensus about the definition of an implementation strategy. Perhaps the main challenge in defining implementation strategies is that implementation research draws insights and techniques from a range of disciplines, including economics, management, social psychology, behavior science, and applied statistics. And of course, each discipline comes with its own techniques, norms, and jargon. Here we are going to present two possible definitions for implementation strategy. The first one is based on the paper by Proctor and colleagues in 2013, where implementation strategies are defined as methods or techniques used to enhance the adoption, implementation, and sustainability of a clinical program or practice. So, let's give an example. An implementation strategy used to improve the coverage and quality of immunization programs is supervision lists. Another important definition is the following. Implementation strategies can be defined as strategies needed to deliver or implement the products or interventions. Let's illustrate this concept with a real-life example. In Module 1, Professor Oladel Okagun described a very interesting implementation research project related to home management of malaria. Do you remember? One of the specific objectives of this study was to assess whether bringing information, education, communication activities and prepackaged drugs closer to where people live improves the compliance for caregivers with treatment for childhood fevers. In this study, the following strategies were developed. Training community-based providers in home management of malaria. Malaria supply of prepacking closer to where people live. And also the use of different colors and pictures on the prepacks with message to help caregivers to recognize the appropriate treatment. Another example is related to the development of intervention-specific tools to malaria control in schools. Implementation strategies are very important in implementation research. Why? Because they represent the how-to component of changing health service delivery in low and middle income countries. So don't forget, implementation strategies are related to the how-to component. Now that we have defined implementation strategies and that we have presented some examples, let's come back to the identification of different types of implementation strategies. In previous examples, we saw that the complexity of implementation strategies can be very different. A very simple strategy is the intervention-specific toolkit for malaria control in schools. Other examples include local need assessments, stakeholders consultation, community visits, and meetings. Well, in this case, when only one strategy is developed, it is usual to call it discrete or single component strategy. Now, be very careful because in some publications they are also called implementation interventions or actions. Now that let's consider the situation where several strategies are combined. In this case, it is called a multifaceted implementation strategy. An example is training, consultation, audit, and feedback. There are also some implementation frameworks that include a number of discrete implementation strategies combined in the specific way. One of these models is the Replicating Effective Programs framework. This model provides a roadmap for implementing evidence-based interventions into community-based settings through a combination of several strategies in order to maximize the chances of sustainable interventions. The model includes a number of discrete implementation strategies across 4 phases. The first phase is preconditions. The second phase is the pre-implementation. The third phase is the implementation, and the last phase is the maintenance and evolution. Examples of strategies include on each of these phases are represented in this figure. We saw that in the REAP model, implementation strategies are classified according to phases. Another approach is to group the implementation strategies in terms of the actor or the stakeholder using them. Usually, implementation strategies include enhancing the capabilities of government, improving the performance of provider organizations. But they include also strengthening the capabilities and performance of individual providers. They include also empowering communities and households. And finally, they also are related to supporting multiple stakeholders engaged in improving health. This information can be organized in a table where the first column corresponds to the main actor and the second column corresponds to the implementation strategies. There are some examples of implementation strategies at different stakeholder levels. At the government level, policy reviews are usual implementation strategies. At the community level, training and community mobilization are frequently implementation strategies. Finally, situation analysis is a very good example related to multiple actors' implementation strategies. Now let's go back to the example related to home management of malaria. One of the strategies was to conduct a situation analysis. And this situation analysis was used to develop a better understanding of community process and community perception of the use of pre-packs for treating fevers in children, also to document community concepts of ill health and perception of malaria treatment-seeking behavior, and to identify channels for communicating health information. these situation analyses were also very useful to document drug names, design of prepacks, and different age groups, nature of packing, etc. In this case, what are the main actors? Yes, the main actors are multiple actions. Another strategy was training community-based providers in home management of malaria. In this case, what are the main actors? Yes, the main actors are the community. Finally, in implementation strategies related to information, education, and communication, what are the main actors? Yes, the main actors are communities and households. As a summary, we saw that the actor or the stakeholder is an important dimension for implementation strategy specification. However, as we will see later on, there are other key elements for implementation strategy specification, namely the action, the target, temporality, dose, implementation outcomes, and justification. We are going to be talking about some of these issues in greater detail over the coming weeks. That brings me to the end of what I wanted to cover today. So, over the next coming weeks, you are going to be hearing a lot more about each one of these issues. And it's a pleasure to be with you today. Thank you for your attention.